Do you know what hypertension is and why it's a global health concern? Hypertension or high blood pressure is a chronic medical condition where the force of blood against your artery walls is consistently too high. This can lead to health issues such as heart disease, but why is it a global concern? Well, hypertension is linked to increased health risks and mortality, making understanding its basics crucial for everyone. Now, to grasp hypertension, we first need to understand blood pressure. It's the force exerted by blood on the walls of your arteries as your heart pumps it throughout your body. Normal blood pressure is when the systolic, or the top number, is less than 120 millimeters of mercury, and the diastolic, or the bottom number, is less than 80 millimeters of mercury. Hypertension, however, is when these numbers are equal to or exceed 130 and 80 millimeters of mercury, respectively. This is why hypertension is a significant health concern worldwide. Did you know there are two types of hypertension? Yes, indeed. Let's delve into the details. First, we have primary or essential hypertension. This is the most common type, accounting for about 90% of all cases. The peculiar thing about primary hypertension is that it doesn't have an identifiable cause. It's a bit like an unwelcome guest who decides to move in without even giving a reason. It tends to develop gradually over time, often due to a combination of genetic factors and environmental triggers. On the other hand, we have secondary hypertension. This type is like a domino effect. It results from an underlying condition. Some of these conditions could be kidney disease, hormonal disorders, or certain medications. Unlike its primary counterpart, secondary hypertension tends to appear suddenly and causes higher blood pressure levels. Knowing the type of hypertension helps in proper treatment and management. So it's always important to keep a check on your blood pressure levels. Several factors can increase your risk of developing hypertension. Age is a significant factor. As we grow older, the likelihood of hypertension increases. Genetics also play a role. If hypertension runs in your family, you are more prone to develop it. Lifestyle choices too are crucial. Obesity, a sedentary lifestyle, excessive salt intake, and stress can all contribute to higher blood pressure. But hypertension isn't just a silent condition. It can lead to serious complications if left unchecked. Over time, the constant pressure can damage your blood vessels, leading to heart disease. It can also cause stroke by blocking or rupturing blood vessels in the brain. The kidneys, which filter waste from the blood, can also suffer from the strain, leading to kidney dysfunction. Lastly, hypertension can cause vision problems by damaging the blood vessels in the eyes. Being aware of these risk factors and complications can help in early identification and prevention. Diagnosing hypertension involves several critical steps. Let's start with office-based blood pressure measurement. Here we use a standardized technique with a sphygmomanometer, taking multiple readings to account for variability. The classification is then based on average readings. Next, we have ambulatory blood pressure monitoring, or ABPM. This involves 24-hour monitoring using a portable device, providing a comprehensive profile of blood pressure fluctuations. It's particularly useful for diagnosing conditions like white coat hypertension and masked hypertension. Lastly, we have self-measured home blood pressure. In this method, patients themselves measure their blood pressure at home. This helps track daily variations and assess the effectiveness of treatment. Remember, each of these steps plays a crucial role in the accurate diagnosis of hypertension. In turn, a proper diagnosis paves the way for effective management, helping to control high blood pressure and prevent complications. A proper diagnosis is the first step towards effective management of hypertension. Hypertension can have severe effects on various organs. Starting with the heart, high blood pressure increases the workload, leading to left ventricular hypertrophy. This condition magnifies the risk of heart failure, arrhythmias, and coronary artery disease. Moving on to the kidneys, hypertension can cause renal blood vessel damage. Over time, this can lead to nephrosclerosis, proteinuria, and ultimately renal failure. The brain is not spared either. Elevated blood pressure increases the risk of stroke, transient ischemic attacks, also known as mini-strokes, and cognitive decline. Lastly, our eyes can also be affected. Hypertension can cause a condition known as hypertensive retinopathy. This condition is characterized by arteriolar narrowing, hemorrhages, and exudates. In conclusion, it's clear that hypertension is not just about high blood pressure. It's a systemic condition that can affect almost every organ in our body. Understanding these effects can help in better management and prevention of complications related to hypertension.